The recent announcement of a delay in the reopening of schools has been met with mixed feelings, and our parents have been divided between the safety of their children from the pandemic and the added demands of looking after children who are forced to stay idle at home. Joining us now to take us through how COVID-19 affects children and whether the second wave of infections may impact children in the same way as adults is paediatrician Dr. Simon Strachan, an executive member of the Paediatrician Management. Dr. Strachan, a pleasure to have you on the program this afternoon. And now parents are being urged to remain cautious, although there are lower risk of severe illness or even death for children. Just talk us through how COVID-19 affects children, and does the second wave of infections impact children the same way as it does with adults?
Good afternoon, Atlanta. Thank you very much, and good afternoon to the viewers. Yeah, I think that's the point, is I think we have to be extra vigilant. We're at the worst case of the pandemic and everybody needs to be looking after everybody else. But if you look at children, let's talk about children under 10 years of age, and you look at the cumulative incidence of infections across since the beginning of COVID, there's been a steady increase in children. But children under 10 years of age still only account for 2.5% of all cases of COVID, 2.5% of all cases of COVID reported in South Africa since the start of the pandemic. And yet that age group under 10 years of age accounts for about 20% of the population of South Africa. So just from those figures, you can see that far fewer children are contracting COVID as compared to any other age group. Right. Taking that a step further, of all the admissions of children under 10 account for less than 2% of all admissions. And for deaths in children under 10 is 0.02% of all deaths. So any death is a tragedy, and any death we try to avoid. But in children, there is no question that children, first of all, get a milder form of illness compared with adults. And going through my colleagues, and we've done this over the last 48 hours, asking who's seeing children with COVID, there are very few children that are needing admission for COVID. In terms of the second wave, there's no evidence that the second wave is affecting children any worse than the first wave. Just the sheer numbers of patients that are occurring in the second wave. Obviously, there will be more COVID in the second wave than in the first, in the younger age groups, just as in the older age group, but there's no evidence that there's more severe disease. We do see a disease in children that is slightly different from adults, and that we call multi-system inflammatory syndrome. And this typically occurs 2 to 3 weeks after a child improves from having COVID, and they present with acute illness, with severe inflammation, very high fevers, and in those children very often having heart problems and needing heart support, cardiac issues. So we are on alert that we may see this start to increase as time progresses through the second wave. But as of right now, children are still being affected the same as in the first wave, just the numbers are more.
So judging by what you're saying, it would appear that children don't appear to be super spreaders of COVID-19, although they can still be infected. Now, should children not be part of this vaccine rollout?
So none of the vaccines have been tested or registered for for people under 16 years of age. So the easy answer to that is no, they shouldn't, because the vaccine has not been tested, and we can just leave it there. But again, we're looking for herd immunity. There are many countries where resources are limited. And if you want the best bang for your buck, where should you be vaccinating? Vaccinating which population group, which age of population, let me put it that way, which age of population is going to give you your best bang for your buck? And the answer there is that's not the young children. So from that point of view, from an epidemiological point of view, no, I would not be rushing out and choosing the young children as my first line of vaccination. But to go back to the simple answer is that the vaccine has not been tested in children under 16. So no, we're not surprised that we're not being included in the vaccine rollout.
Dr. Strachan, I hear you, but what are the issues, especially with developing a safe and effective COVID-19 vaccine for children? And where are we regarding the clinical trials to test out if vaccines may be safe for children?
Yeah, so I think, Lanta, sometimes we need to just take a step back and have a reality check here. If you think about it, the first case of COVID was only identified in South Africa in March. That is only 10 months ago. And in that time period, we have at least 5 or 6 vaccines that have come to market and many more in the pipeline. There is a research and safety protocol that has been developed and pushed through in 10 months that it usually takes years. Large numbers of patients. So I'm not for a moment suggesting the vaccines are not safe. I think there's been ample work done and there's lots of post-marketing surveillance. So whenever you want to expand that level of research to include every single population group, it's going to take far longer. We're not going to achieve. And even the vaccines that are being licensed have only really been tested in people between the ages of 18 and 55. So again, I think what we need to look at is the fact that children are the least affected population group. And for now, we are not expecting to have a vaccine for rollout. The point is that this SARS-CoV-2 virus does not necessarily going to disappear. You know, when a population gets herd immunity, when sufficient people in the population have had the infection or been vaccinated against the infection, and there's what you call community or herd immunity, that doesn't mean the vaccine has disappeared. It means that that vaccine is still around, and every year, as new children are born and as they get older and they progress through the ages, that vaccine is going to be around. So I have little doubt that with time, this vaccine will be developed for children, and it may well, with time, become one of the more routine vaccines that are given to younger children, so to maintain herd immunity.
So, Dr. Strachan, we are running out of time, but I think it's important that we also get your advice to parents, just in as far as ensuring that they take the precautionary measures to ensure that their children's immune systems are in place to fight off this COVID-19 infection. How do they go about doing that?
So I really don't think that there's anything special about COVID-19 immunity that you need to have. And I think that one of the misconceptions is that children, especially creche-going children, that they are getting sick because their immune systems are weak. They're not. They're getting sick because they are being exposed to viruses that they've never seen before. So what can you do for your child? You can make sure your child is fully vaccinated against every other possible thing that we have vaccines for, and there are many in the EPI schedule. We can make absolutely sure that children are well-fed, well-nourished, well-exercised, and that any child who is ill, or any child who has a very poor diet, or any child who has a known vitamin deficiency must then take supplemental vitamins. The role of extra vitamins in treating COVID has only really been shown to be of benefit in people who have a vitamin deficiency. Pumping your body full of extra vitamins doesn't necessarily make a big difference. What you need to be sure of is that the vitamin levels are correct and accurate for your body. And you can achieve that predominantly through good diets. So if your child is eating well and eating a good balanced diet, you're fine. If not, supplement with vitamins. And lastly, make sure as far as possible that your children observe the non-pharmaceutical interventions, like the hand washing and the masks. And children are very compliant and obedient with these things, especially if given by if the advice and recommendation is given by loving parents and caring teachers and caregivers. So I think that's the best advice I can give.
Well, Dr. Strachan, thank you very much for your time. That was paediatrician Dr. Simon Strachan.